Hello, I'm Teresa Gully, and I'm the director for the School of Nursing. Here at Millikin, we have been blessed with having our equipment updated recently, which has been amazing. So we have the health assessment lab, we have simulation rooms, we have 4 simulation rooms with 2 control rooms, debriefing rooms where we can go through a extensive simulation scenario where students are extremely involved and independent running through scenarios. So we have the high fidelity simulators, which can actually run through scenarios. So as students are running through a scenario, say a patient has asthma symptoms, they are in the room, either them or one other student, and without the instructor, but they're in the room with this patient, and as they do well, as they're treating the patient can get better. If things aren't quite going right, the patient can get worse. So the scenario changes, and that's one of the excellent things about these high fidelity simulators is that we can modify how they respond. They actually are listening to heart sounds, listening to bowel sounds, they're listening to the lung, everything about that patient, as well as the vital signs. Some of them will actually change color, where you can start to see cyanosis. So they have great capability to make it as real as possible without being directly with a patient.
Hi, I'm Kelly Slade. I'm an instructor with the School of Nursing at Millikin University. I am also a practicing nurse practitioner in our health clinic. Training on simulators is really important for our students to get a first look at what a patient may look like in the hospital or in a clinic and let them be better prepared for the actual real event. The educational philosophy is performance learning, which means taking our students to clinical sites in our communities and surrounding communities, working with current nurses, shadowing them, helping them take care of patients, and really learning the ins and outs of an everyday nurse. In our School of Nursing, our curriculum is really based on what is needed in nursing today. We have several different types of classes. As we all know, there are lots of different types of nurses. So we offer that opportunity to our students to try to figure out exactly where they want to go and where they'll be most effective.
Our program, I think one of our prides is really our faculty. We have excellent center, as we have in our simulation center, our health assessment lab, but it's the faculty that make a difference. We have small class sizes where the faculty really connect with the students. Students are open to come to faculty for assistance and help. The faculty really want students to succeed, so they invest their time to help students succeed.
One of my favorite things to do is receive texts or emails from former students. Just last week, I received a text from a nurse who was a former student, received 2 DAISY Awards, which are awards for nursing and their competence and compassion.
So here at Millikin, we are able to have 100% job placement for our nurses. So it's part of being a nurse is that we are in high demand. But not only are we in high demand, but our students are in high demand. When they're going to employers and they see that they graduated from Millikin, usually that gives them a leg up because they know our students come in prepared. They know that we have the background of why they do what they do. We're not just task-oriented, but we're thinking. Our students use that critical thinking on a daily basis. So our students are highly sought.